Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our deep dive into the world of nursing preceptors. So in the first episode, we explored the role that preceptors play in shaping the new nurse's career. And we talked about a lot of the qualities that make exceptional preceptors, and also a little bit about the art of providing feedback to new nurses. So if you haven't listened to the first episode, I highly encourage you to go back and listen. In this episode, we're going to talk about some of the practical tools and strategies to excel in this role. And I kind of want to pick up about where we left off on the previous episode. We talked a lot about being a preceptor, and it's such a rewarding experience as you see someone grow in their role, but it also comes with challenges. And so, what are some of the common hurdles that preceptors face, and how can they be overcome?
Oh my goodness. Okay. So, deconstructing bad habits, that's a challenge. There's performance issues. There's interpersonal conflicts, work-life balance, how to handle unnecessary stresses. And it's going to require a lot of clear communication, emotional intelligence, and problem solving for the preceptor. Deconstructing bad habits is one of the biggest ones that stands out to me because, it's poor practice habits, and people have picked up poor practice habits. And so new nurses and experienced nurses, both, they're going to bring ingrained habits or techniques, or in the case of experienced nurses, they're going to bring old practices that maybe have been changed due to new evidence. And one that still, even today, sticks out to me the most, that I still see the most. Prime example, urinary catheter insertion. And I know you've seen it too. I've had to correct this often with experienced, really good LPNs who went back to school to become an RN, because you start critiquing in both of those scenarios, and you're going to have to find the root cause of whatever this bad habit is. Root cause for urinary catheter is that they were taught previously how to do it the other way. Now we have a new way of doing it. So you will have preceptees that will struggle with their skills, their confidence, their clinical reasoning abilities. Some will be too confident. Some will not be confident enough. So you're going to have to balance your constructive feedback with positive reinforcement, going back to your ongoing assessments and looking for those competency gaps. Interpersonal conflict is also going to happen, and sometimes it's unavoidable, but there's going to be personality clashes. Maybe it's poor communication, maybe it's poor comprehension, or poor perception maybe is a better word over comprehension. And I've seen respect issues come from both the preceptor and the preceptee. So during those interpersonal conflicts, you're just going to have to, as that preceptor, you're the role model for professionalism, and you're going to have to remain professional. And I tell my students and I tell my kids all the time, you can't control how other people treat you, but you can control how you react to it, because how you control how you react to that and how you treat them, that's your character, not theirs. So lead by example, using that emotional intelligence. Precepting time versus normal job duties is also a challenge. So it's going to, take time to take care of your patients while also trying to teach and grow a new nurse or a new employee to the unit. It's going to greatly increase your workload. And a lot of times there's minimal compensation, which includes time and money. So you also have unnecessary stresses, unit politics, demanding leadership, and, maybe even wherever you are, organizational dysfunction. And there are other examples that would fall into this that you may be dealing with. And in this case, my advice is to keep yourself focused on the mission. Why are you precepting? You're precepting to develop a new nurse or a new employee, and work when possible to really minimize those external noises. While, yes, we know it's stressful, that external noise, you can still work to create a supportive learning environment for your
Absolutely.
precepting.
And one of the things I had to keep in mind as a preceptor when I was on the floor is ultimately this person that I'm training, this new nurse is, they're there to fill a hole, but they're there to be my coworker, and I want to train them
Yeah.
right that way that they are providing safe practice alongside of
Hmm.
me, so then I can depend on them.
Absolutely.
So it's a gift that I'm
Yeah.
giving them, but later on it's going to really come back and help me as they're my peer. Um, yeah, but one of the
Right.
things that you
Yes.
said really kind of stood out to me when I'm thinking about, we have to keep a supportive learning environment. We want them to learn. We also want them to stay, but we also have to keep a good balance with
Right.
patient safety because ultimately that the one constant priority that trumps all other priorities in nursing is patient safety. So how can we strike that good balance?
Yeah. Well, it's going to be about creating an environment of high expectations, accountability, and continual coaching. It's not about harsh criticism and unsafe practice. Preceptees need enough of that security to help them develop their capabilities while you're still holding them to rigorous patient safety standards because they should
Right.
be under prudent supervision. So, establish a blame-free environment of trust and showing them respect, but you're also still making sure you're upholding patient safety. It's feeling safe psychologically. You hear the term psychologically safe. It's really big in leadership right now. I teach it in the leadership classes. So assure that your preceptee, it feels safe. It's safe for them to admit uncertainties, ask questions, voice concerns without ridicule. And you want to be mindful of your body language too and your word choices because that alone can shut down communication between you and your preceptee. You want to have your preceptee feel comfortable to um, not only ask questions, but they're going to
Yes.
make mistakes, you know, and we want them to try to learn and they need to be able to do so without undue anxiety. You hear a lot about just culture, and this is just another area where you can use that by making sure that the aim is continuous learning, system improvement, and not individual blame and punishment. You have to yourself model professional accountability by taking responsibility of our own lapses. We all make mistakes. Even in front of our preceptee, we're going to make mistakes and we need to own those mistakes. And another way is to set appropriate boundaries with your preceptee. For example, establish like I'll call them situational triggers for when you're going to step in because something is potentially harmful. They're about to do something that's going to be potentially harmful. So if I see something that you're about to do that's unsafe, I'm going to intervene. So when you see me step in, you quietly step back. The goal is not to embarrass them. So don't make a scene. You just quietly step in. And as the primary nurse, you still have a duty to intervene if safety is truly at risk. So in that moment, it's
Right.
probably not a teaching moment, right? You're going to want to debrief it afterwards because after any high risk situation or true patient safety issue, you got to take some time to debrief and it needs to be prompt because that's where you're going to reinforce those learning outcomes and just thankfully it's not going to be an actual error that you're having to debrief and report.
Absolutely. And, when I'm working with preceptors, I think one of the things that I did, and it's important, is to, establish that communication beforehand of when we go in this room and if there's something that I deem as unsafe or that I think that you need a little help with, I'm going to step in and, we'll talk about it afterwards outside of the room and just to reassure them that
Right.
you've got their back, but you're not there to embarrass them. You're not there
Yeah,
to berate them. You want them to learn, but you also want to keep those patients safe. Yes. Yes. And then
absolutely.
we know that the landscape in healthcare is becoming increasingly diverse. So, how does cultural competence play a role in that effective preceptor preceptee relationship?
It's going to go all the way back to that psychologically safe learning environment that you as a preceptor should be providing. Different cultures are going to have varying norms around even just their communication patterns. And that's really one of the areas that I see the most tension
Right.
is directness. when you're communicating. So, cultural backgrounds are also going to shape our own perspectives on health, on healing, on family roles, and even, medications versus traditional remedies. So, unfortunately, we all have these ingrained biases. You hear them. The hot topic word right now is implicit biases, but they really do inadvertently impact our interactions and our evaluations every day. So, what can you do? Well, mutual understanding of cultural influence on factors like communication styles, health beliefs, and respect are really important. You're going to have to adapt your approach depending on your preceptee's background. You're going to have to self-reflect on your own implicit biases. There's not a one size fits all approach. And as you take time to get to know your preceptee, you're going to have to tailor your teaching methods to be to their culturally preferred learning styles when it's possible. Because honestly, most of our attention in these relationships are going to be comprehension and perception, which a lot of times is not the true intention of the action or the statement. So do check-ins and make sure you are keeping those lines of communication
Absolutely.
open.
I agree. I think sometimes we can, as people, shy away from having those tough conversations and, find out what trying to think of the word, what influenced behaviors, what made them make certain decisions, and we just don't truly understand. And so checking in, I think, is so important. And checking in not only with them that they're okay, but checking in with our own selves of, how we feel about things and how we can improve to help them better. So yes. And so, and let me just say, I know not every nurse automatically becomes the greatest preceptor. I've worked with some amazing nurses, and I would they are not. There's one I
That
worked
are
with.
not
He
good
he
teachers.
was
Nope.
amazing. I would call him in a crisis every time. If I needed to do a code a patient, he would be right there. But I also did not need him to talk to anybody. Didn't need him to talk to the patients, their families, or anything. But he knew his limits. He really did, and so he knew he was not a good preceptor, and he would say, "Don't put me in charge of precepting either anybody. I'll be the charge nurse. I'll do all the other things, but that is not the role for me." And so I'm sure that you've worked with people like that before. How can nursing leadership, really identify and empower those people who are the best for this role?
Well, I think first of all, you hit the nail on the head. Not everybody is meant to be a teacher, and you need to know that you're not a teacher. And thankfully, he knew that he was not a teacher, and that's really important. You need to know whether you can do this or not. But your best preceptors are usually identified, by their track records. Their track records are going to show excellence, enthusiasm. They're going to have those interpersonal skills, and like I said earlier, they want to teach. So it's as simple as that. They need to have a passion for growing new nurses. You cannot train someone to have passion for something. I can help them grow in other areas to be a good preceptor, but I can't help them grow in that area if teaching is not for them. And then there's also a need to make sure we train and support our preceptors. It's great that, to have a preceptor class, something like this where we're talking through what it means to be a preceptor, but, specialized training on preceptorship, teaching methods so you can understand how to teach, how to evaluate, how to work through conflict management, and even giving feedback, how to give feedback and work through that are really important as
Yes,
well.
I agree. Giving feedback to me is probably one of the things that I, just as a preceptor, struggle with the most until I just had to flip it around in my head a little bit and realize what a gift it is to be able to provide that to them. But they need it because that's going to be what helps them to really develop those clinical reasoning skills that we were discussing in episode 1. This is a little bit of a transition off of the question flow, but one of the things that I see in some of the preceptor programs is the use of technology. Technology is a fabulous thing. Tell me about the role of simulation and simulation training, and what a sim lab can do to help us with training a new nurse.
Yeah, simulation is really invaluable. I mean, the best part, and you can probably agree with me on this as an educator, but the best part is it's all in a safe, controlled environment. I think that's the best thing. But simulation, it really gives preceptees a lot more opportunity for deliberate practice, for competency measurements, and it really helps in bridging the gap between knowledge and real world application, all in a safe, controlled environment, and when you couple simulation with actual guided debriefing from someone who's experienced in debriefing and experienced in the topic, I mean, you've got such an incredibly powerful teaching modality. It's those deliberate practice opportunities for more exposure to, we call them the low frequency, high risk events, like codes and other emergency scenarios that preceptee is probably not going to encounter as much. And the other thing about simulation is your scenarios, they can start so simple, and then you can just keep escalating that complexity up. You're going to force that preceptee to really integrate knowledge from a whole different domain, and think critically as that situation continues to evolve. Simulation is just really one of the best ways that we have right now to replicate the realities of how to transition their theoretical knowledge that we're giving them into actual practical clinical reasoning abilities. So it's just, simulation is just another way to validate competencies and help you identify gaps so that you know where to focus your training
Right.
and your feedback.
Yes, I love that. And I love simulation. It is a great place to practice in a safe environment. And it's really where I want people to make mistakes. If they're going to make the mistakes, let's make them in that safe environment so that we can
Yeah.
correct any behavior that we need to and really give them that constructive feedback. Um,
And really, their teacher doesn't need to be in the
correct.
simulation room with them because, most students don't want to make mistakes in front of their teacher.
Yes,
Give them a safe place to make mistakes. So remove yourself and let somebody else who is experienced come in
absolutely.
and
I
work with the
agree.
students.
I agree. Well, a little bit more about precepting. Just being a preceptor, of course, we talked about it is juggling multiple hats. And I remember precepting a fantastic new nurse, and she was eager to learn. And she wanted to know all the things, which was fantastic. But it is a juggling
Yeah.
act. We had a complex patient. We had a lot going on. She was asking great questions, which is fabulous. But ultimately, I had all these patients to see, all this documentation to complete, deadlines looming. And by the end of the shift, I feel like I barely scratched the surface of like, I just stay a little late to finish documenting. And I felt like at the end of the day, she didn't learn everything she needed to
Right.
know because it was so busy. So, how can preceptors
Yeah.
navigate like all these competing priorities? Patient care, of course, is important. Patient safety is first, but teaching, how can I fit it in there with all the demands without feeling like we're on the verge of dropping the ball?
It's it's a difficult juggling act. It really is. And the best things that you can do are to stay organized, set boundaries, prioritize well. When you have a preceptee, try to negotiate having reduced assignments when you can, delegate and
Yes.
delegate effectively. And you and make sure that you are managing your preceptees workload. That's also very important for their success and your success. And I know this is hard because you need leadership buy-in. You need them to understand the work and the time it takes to be a good preceptor, and how important this role is for the development of the future workforce. So, if they're not there, I know it's really hard. It's a difficult juggling
Yes.
act.
And let's talk a little bit more about emotions and resilience in nursing, because as a preceptor, I think sometimes it's easier to teach the technical skills, because I can observe whether you can put the IV in. I can teach you how to do the IV, but helping them with emotional support and resilience to me is hard. So, what are some best practices for helping with emotional support and resilience?
Worries and being overwhelmed for a preceptee,
Yeah.
it's expected. acknowledge those worries, normalize those feelings of being overwhelmed. They're learning. And for a new graduate, they're really getting into seeing what this role actually is. And they may even question if they can do it, or if they even
Right.
did I make the right decision in going into this career choice? I don't know, but even the most experienced nurses will find themselves overwhelmed at times, with the workload, the patient assignment, the patient care situations. And so you can't let them think that you're superhuman or unfeeling. It really sets an untrue expectation for them. And it's an expectation that they're never going to be able to meet in their role as a nurse. So don't set them up for that emotional and mental failure. You want to really actively build confidence by giving them positive feedback, celebrating their successes. You want to manage their burnout risk and promote self care habits. And through this relationship, you are actually role modeling. So be a holistic role model, push for holistic care for our patients. But we have to also holistically care for ourselves and our
Yes.
preceptees.
And I wanted to talk about too constructive feedback. It's an art. It's definitely an art. I think even in my own personal life, you know, my husband was trying to give me some constructive feedback
Oh,
yesterday,
yeah.
which was not appreciated. But
Yeah.
at
There's,
work, there have been times where I've had to give that constructive feedback to preceptees, to students, and I want it to improve their performance. But it's easy for us to become defensive as the person getting the feedback. We want to become defensive and really, I guess, defend our own self and like, this is why, it's because of these other circumstances. But as a preceptor, I want them to hear like, you're doing great, but these are the areas that you need to improve. So how
yeah.
can we help navigate that and try to reduce that defensiveness?
Right. And, communicating is hard, even when we're not in a teaching learning relationship. It's all relationship. So it's a great question. And where to even start would be
Mhm.
emotional intelligence is really key here. First, you're going to have to separate the person from the performance gap. And you want to make it clear that you respect your preceptee as a person and as a professional. So, as an example statement, I know you to be a caring nurse. So, which makes me confident that you want to improve. You don't want to just walk into it criticizing them. You want to start with asking the preceptee's perspective first, like, how did you feel that interaction went? Because that's really going to avoid immediately putting them on the defense, because you're genuinely showing that you're interested in them and that you're interested in their perspective. You want to make sure you're using non-judgmental language with them. So you should be describing the opportunity for improvement, not assigning the blame to anybody, because that's not what's important here. The blame is not important. This is all about learning. So instead of saying you failed or your performance was unacceptable, you could, use more objective, neutral phrasing like the documentation didn't meet the standards because. And you know what?
Right.
They may become defensive anyway. So taking feedback, like you say, it's hard, and you may have to work through their defensiveness to help them learn. So if that preceptee becomes defensive, we have to remain composed and reinforce our supportive intentions. I can sense that my feedback has upset you, which absolutely that was not my intent at all. This is just about addressing blah blah blah, the process, whatever it is. So the goal is not to criticize. The goal is to help them learn. You want to use collaborative problem solving and just kind of let them develop an improvement plan that has concrete steps towards their success. And then of course that continual supportive feedback. Take time also to validate their efforts, where they've improved, and continually give those positive reinforcements when you see that incremental growth throughout that entire preceptor-preceptee relationship. And that makes it a little bit easier to take the constructive feedback when it comes. And
Yeah.
it's gonna come.
Yes.
It's gonna
And that's the
come.
thing. No matter how good we are, we all have areas to improve. And I like how you started with, I
Right.
know that you're here to take care of the patients and really bringing it back to what's important is the patient safety and that we want to get them there. So, um, and I wanted
Right.
to move to a little bit of a different area too, is legal regulatory areas, because understanding legal and regulatory aspects is key, because preceptors play such a
Right.
crucial role, but with that comes legal responsibilities. So tell me about the legal and
Continuing.
regulatory factors that the preceptors should know about for their role.
Well, of course, the first one is our scope
Yeah.
of practice standards. Maybe you're an RN and you're working with an LPN, or an LPN working with a CNA. You have to understand the scope of practice standards, and we have to teach our preceptees those scope of practice standards as well, so that they know what they can and can't do. So don't allow a preceptee to take on any type of role or perform any skill that's beyond
Right.
their professional scope of practice. And you really need to make sure that your preceptee understands and that they're operating strictly within that defined scope of practice for their particular license level, or what they've been validated that they can do before you allow them to perform those. Okay. Delegation,
Right.
huge gray area, honestly, delegation really is. But you need to monitor that those accepted delegation standards and policies are being followed. And then, honestly, um, teach principles of appropriate delegation, how to supervise, accountability, like who's accountable to do what, because all of that is going to fall under legal and regulatory factors and can really get someone in trouble, because you may be having someone do something outside their scope of practice, especially when it comes to delegating tasks to unlicensed personnel, and you didn't know you were doing that. So you need to make sure your preceptee knows and understands appropriate delegation. And then, of course, you have those like reinforcing HIPAA, reinforcing data security, reinforcing patient confidentiality regulations. You want to make sure your preceptees actually understand this, so that they're not improperly accessing or discussing or sharing protective information. And this goes back to us as preceptors modeling those professional boundaries and regarding patient safety. When it comes to upholding ethical standards, you want to make sure you're teaching how to report violations through the appropriate channels so the preceptee knows if they ever come into that. And you also want to make sure that we model patient advocacy within the boundaries of our role. So, to sum it up, preceptors, we have to reinforce that scope of practice standards, our delegation guidelines, our risk management protocols to help avoid liability issues. And you know what? At the end of the day, it's situational awareness for legal risks and organizational policies are needed. And they're only going to learn
Right.
that through
Right.
you.
That's good. I really like that reminder is, they're only going to learn what we are able to teach them. So, and I want to talk just a minute too about
Hmm.
precepting. So, precepting the new grad versus a nurse who is venturing into a new area of practice can be vastly different of how you teach and what even needs to be taught. So, what are some of the
Absolutely.
challenges the
Yeah.
preceptor may face when guiding the role a nurse through a transition from maybe one area of practice to another?
Yes, and there's a little bit there's quite a bit of difference between a new nurse versus a transitioning nurse. So when you're orienting experienced nurses to say like a specialty area, you're going to have to assess the remaining knowledge gaps still. So you might even end up shoring up some supplemental skills for them and transitioning them more as a co-learner who can kind of cross apply some experiences. So it's all going to be about striking the right balance. You're going to want to honor that transitioning nurse's expertise, because that's, again, you can have a point of contention there, but you're also having to ensure that the mastery through that they're going to need for whatever this position is. So your teaching learning relationship is going to be a different focus than your brand new nurse. You're going to have existing clinical foundations, so your focus should be more specialty specific or unit specific knowledge gaps when you're evaluating them, depending on where they're going. You want to assess the understanding of those core conditions, procedures, protocols, standards of care for a new specialty population. And it's also a good time to identify any outdated practices or habits like we talked about earlier. So they're going to bring a lot of transferable skills when they come. Time management, typically they're going to bring communication and critical thinking skills. So you really want to be respectful and validate their current competencies and these skills, and then just helping them expand on specialty skill application. A big one is assessment parameters, especially like if I went from ICU to pediatrics, I'm going to need a whole refresher on how to assess pediatrics. Like I don't know how to do that. But because that nurse is really joining the
Right.
relationship with an hopefully already solid foundation ability, or at least we hope so, they're not going to require the basic level
Yeah.
instruction. So, don't accelerate their learning too fast without validating, truly validating those specific specialty competencies. But typically, the preceptors can really progress the preceptee more quickly through introductory concepts and really move them right into their new skills. So you're going to be able to leverage what they have. And typically, your experienced nurses are going to have stronger self-directed learning abilities. So you can really use that to do like more self-study and research in that specialty area, and then, help them apply different concepts through like case studies and simulations and clinical experiences, which is also why you can typically progress them a lot more quickly. I will say a challenge is overconfidence sometimes because of the prior experience. So you will find that sometimes they can overestimate their skill transferability. So do watch for that. You will also want to use your emotional intelligence in this relationship too, because there can be an ego challenge between you
Yes.
and your preceptee. You have to be more self-aware. And I can share that my background is ICU, and I moved overseas, and I was like, I'm going to work in this military hospital. I'm going to try to work in this med surg unit. And they assigned me to a nurse, and I, on the med surg unit, and I felt like they saw my background, they saw my resume. And from day one, I felt like I couldn't ask any questions. I remember asking how often I needed to chart. And I know that seems like a really like just technical, but because in the ICU, we chart every 1 to 2 hours. Sometimes I chart every 5 minutes. Like it just depends. And so when I asked that question, I kid you not, I was met with rolling of the eyes, sarcastic comments like, this is not the ICU and blah, blah, blah. And then I would hear them talking about me and laughing when I wasn't at the nurse's station. And it all started with my preceptor. And I just couldn't effectively learn the ways of the unit because of how I was treated. And I felt so like, I don't even know what the right word was or how I really felt, but I have not chosen to work outside the ICU since. So they say nurses eat our young, but there's also sometimes we eat our own experienced seasoned nurses who are really just trying to try something new, and they're not sure. And when we get to the root cause of that, do you know what it is? Jealousy and feelings of
Absolutely.
insecurity from your preceptor. So do pay attention and build rapport, be respectful, let them ask questions, create that psychologically safe environment for your transitioning
Yes, I
experienced
agree.
nurses as
And it's
well.
a shame because when I have a nurse, a experienced nurse coming to a new unit, there's so much that they can bring with them. And we want to value their experience that they are
Mhm,
bringing while, helping them learn to transition. So,
mhm,
um, I
absolutely.
wanted to ask too about a little bit more about technology. So, because technology, our healthcare world is
Mhm.
always evolving, it's always changing. So, what innovative technologies can
Oh,
we
yeah.
use for precepting? What are some distant precepting models, even that may hold some hope for the future?
Yeah. There's some fun things coming. There's some fun things on the horizon. One of them is immersive virtual reality, working to create highly realistic clinical environments and scenarios. Again, high risk,
Yes.
low frequency scenarios. There's telepresence technology coming about, and it's like these cameras or displays that allow a virtual preceptor to
Wow.
be present with you at the bedside. And the preceptor can like zoom in and observe what you're doing and provide real time remote guidance. And I see two things happening with that, and that's enabling preceptor models across like multiple facilities or states, and also allowing expertise from a single skilled preceptor across like larger pools. Because as you said, we're losing a lot of our experienced nurses, and we have a lot of younger nurses trying to precept and trying to leverage the skills that we have. AI assisted coaching is coming. We're looking at that to really automate elements of assessment and remediation, because the thought is that AI is going to be able to analyze the psychomotor skills that we see, that the clinical judgment and communication patterns, which is going to then lead to what they call data-driven, personalized
Wow.
feedback that is going to be then customized for that preceptee. Um, something that we're already using a lot of, that you're, going to see probably growing and being able to use it more and more, is those interactive e-learning modules, the ones with the videos, and then those decision-making vignettes and knowledge checks. And then there's something really cool that I was reading about, and it's called just-in-time mobile resources. And so it's like wearable apps that you can have, or apps on your phone, or things you can wear, but to provide like on-demand virtual preceptors right there when you need them. But it's also the goal is, to allow that preceptee to get those bite-sized guidance videos and those cognitive aids when they're actively already engaged in care activities. So I guess I would say that the future is more headed towards a blending of digital resources with
Yes, and I'll tell you
in-person
that healthcare
precepting.
is always evolving and technology is increasing. I'm excited to see, a little scared, but excited to see some of the technology headed our
Yeah,
way. So we
where it
are
goes,
almost at the end of our
for
time. And
sure.
so I wanted to ask one more question, which is, we've talked about preceptors, we talked about lots of things, but what would you like to leave the nurses with who are either current preceptors or who'd like to be preceptors?
Well, as a preceptor, when you choose to go into this slot, or you're voluntold to go into this slot, you are shaping and you are inspiring the next generation of nurses. The knowledge, the skills, the values, and the habits that you impart to that preceptee are going to have a lasting impact on the caliber of the care your preceptee is going to provide for years to come. So it's more than just teaching clinical skills. You're a role model. Preceptors are going to observe how you communicate, how you make decisions and handle stress, and collaborate with teams, and even how you uphold professional integrity. So the way you carry yourself will shape the perception of what an exceptional nurse looks like and should be. So, really, this is a privilege. Take it seriously. Be intentional about your precepting approach. Remain humble, a lifelong learner yourself, and really work to build a supportive environment of trust and growth, and really never lose sight of why you became a preceptor. It's to cultivate highly competent, compassionate nurses, who are going to, go out and uplift the care in your community and our profession. So each nurse that you touch, each nurse that you develop and grow, is going to be an opportunity to elevate care for countless future patients. Your influence on nursing practice is going to multiply exponentially over time. So, in essence, precepting is all about being an exemplary role model who is going to nurture our whole profession and carry the torch for exceptional nursing to future generations. It's a big
It is
deal.
a
It's
big
bigger
deal.
than we
And
realized.
a huge thanks to you, Candace, for coming and sharing your insights and experiences with us today. And a thanks also to our listeners who are
Yeah,
preceptors or thinking about becoming preceptors, because it's such a valuable role in nursing. And as I end today, I just,
for
to our
sure.
listeners, I encourage you to explore many of the other courses that we have available on elitelearning.com to help grow in your careers and your CEs.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.